Welcome to ASM Live at ICAAC. I'm Michael Schmidt, and I'm one of the co-moderators of This Week in Microbiology. It's my great pleasure to be here at ICAAC, which stands for the Interscience Conference on Antimicrobial Agents and Chemotherapy. This is the cutting edge of what's going on in our discipline, where we learn how to coexist with the microbes. I'm joined here by Melissa Johnson, who is on faculty at Duke University as well as Campbell, and she's going to share with us some really exciting results that she and her students have developed looking at the whole issue of whether or not those of us who are over this magic age should be getting a shingles vaccine. I personally can attest to the fact that shingles is an increasing problem because in the U.S. we all are well aware that folks are living longer. So Dr. Johnson, welcome.
Thank you.
And I look forward to learning of your story here this morning.
Wonderful. We're excited to be in Denver.
It's a great place. So what is shingles?
So shingles is a complication of varicella zoster infection, or chickenpox, which most of us are used to getting as children. But it can live in your nerves and in your body for many years after having chickenpox and recur once you're older and your immunity to that infection wanes. So shingles presents usually with blisters that pop and have fluid in them, and often occurs in the dermatomal areas of the chest and the back, and can lead to a very painful condition called post-herpetic neuralgia, or PHN. PHN can lead to a lot of nerve pain that can last for weeks and months after having shingles.
So the eruption has gone in, and before we went on the air this morning, I shared with you a story of I was home visiting my dad this past Christmas, and his next door neighbor came up, knocked on the door, and said, "Hey Doc, I got this rash." And he proceeded to describe the fact that it was a very peculiar rash because it was only on one side of his body. And as he was undressing in the Chicago winter on the front stoop of my dad's front door, I said, "No need to take off your clothes. Get yourself down to the urgent care and make certain that you tell them that you think you have shingles." And he was really an ideal candidate for that vaccine because he was of the pre-Medicare age. He was over the age of 50, and he would have been an ideal candidate for having this vaccine. So what did your study learn?
Our study demonstrated that although the shingles vaccine was approved for individuals over 60 years of age, starting in the year 2006 or so, by 2008, only 6% of Americans who were eligible for the vaccine had received it. And in the years after that, today, up until 2011, only about 15 or 16% of Americans of the age over 60 had received the vaccine. We also looked at vaccination in those aged 50 to 59 years of age because that is also at-risk population. The vaccine is approved for those 50 to 59 years of age. However, the panel that recommends vaccination hasn't yet added that to the routine vaccination schedule, but it is approved for those 50 to 59, and those 50 to 59 should consider vaccination. And vaccination rates were less than 5% in that population.
So people like me, I'm now over the magic age of 50, so I've enjoyed the colonoscopy, which was, a prophylactic event. And should I encourage a discussion with my healthcare provider to ask them, should I get the shingles vaccine?
Absolutely. Part of the impetus for our research was to encourage Americans to go out and speak to their physician about whether or not they should be considered a candidate for the zoster vaccine. Like I said, if you're a working person, having PHN is incredibly disruptive to your life. It can lead to a lot of pain and having to take medications to manage that pain. And if you can get the Zostavax, you may be able to prevent a significant amount of that disease.
One of the things that I appreciate being a microbiologist and understanding that these fluid-filled vesicles are chock-a-block full of virus is I wear contact lenses, and so there's no way you're not going to scratch. And so I'm very much concerned about, should I get shingles and I have to take my lenses out, who am I going to get to take my lenses out? Because I can't use my own hands because they're likely going to have been inoculated with the virus, and it's really tough to rid human skin of herpes virus. And so consequently, how am I going to get my lenses out of my eye?
Well, absolutely. Those fluid-filled vesicles contain live virus, which can be infectious. So it's important to practice good hygiene when you do have something like shingles. And those that are at risk could also come down with an infection. The infection can spread and lead to disseminated disease, which we call when it affects your eyes or other areas in your body. And we often see such a complication in immunocompromised patients, those, for example, who've had transplants or chemotherapy for cancers.
What about the diabetic population?
The diabetic population is also at risk, and again, just causes so much complications in these patients that it really can be debilitating, because many of them already have nerve pain issues from their tremendous years of diabetes. So this disease can cause over $1 billion in healthcare expenses, and we really want to work towards reducing that.
That's billion with the B. I mean, this is incredible. And you know, when you begin to look at, even if you have to pay for this vaccine out of your own pocket, the post-herpetic medication that you're going to have to control the nerve pain, and the fact that those drugs have side effects that effectively, you know, limit your ability to drive, limit your ability to think, because I've heard from a dear colleague of mine, they sort of make you loopy.
Absolutely. So any of the pain medications can be associated with side effects. The antiviral medications that you have to take, if you're lucky enough to diagnose your shingles early enough to be eligible for those medications, also have side effects. So having the vaccine really can help prevent you from having to take some really, you know, challenging medications to take. The other thing that we noticed was that those without certain types of insurance or lower education, poverty, below the poverty line, had lower rates of vaccination. And it's important for us, you know, across America, as we have this dialogue about healthcare, to really consider the value of vaccination, because it can prevent us spending more money in the long term and more complications from other medications that we have to use and pay for. So vaccines are a great way to avoid some of those.
I always, you know, make the flip remark that they're cheap at twice the price, because, you know, if I had to look at not being able to drive or not being able to think, I mean, I get paid to think for my job. And so if the drugs are really going to impact on my ability to think, I mean, vaccination is a strong motivator for me. And so, you know, I think your study is really, as they say, headline news, because, you know, this is something that is available. It's already licensed. The question that everyone always asks when it comes to vaccines, is it safe? So what can you tell us about its safety?
The vaccine is very well tolerated. There are only a few patient populations who might not be able to be eligible for the vaccine, so speak to your physician about that. A very, very small proportion of the population might be immunocompromised and not be able to receive the vaccine, but the majority of Americans should be receiving this vaccine over the age of 50 or 60, and have a good conversation with your healthcare provider about it.
One of the things I always know about vaccines is you should always get vaccinated when you're healthy, because then the vaccine has a greater likelihood of taking. So what can you tell us about that? I'm sure you do a lot of vaccinations
Absolutely.
in your normal day job.
There has been a conversation about what we call the response to vaccine, and in fact, the response to this vaccine is better when you're younger. And if you're older, say over 85, there's some concern that maybe you don't respond as well to the vaccine as a younger person. So if you are younger in that 50 to 59 age group, that's a good time to consider vaccination, because you may get a better response and have more long-term efficacy with this vaccine.
Can you get it at the same time we're showing up for our flu vaccine?
Absolutely. So you can walk into your provider's office, ask about the vaccine. In many states now, pharmacists are actually licensed to administer this vaccine as well and carry it in the pharmacy. So you can get a prescription from your provider or at the pharmacy, and they can deliver you the vaccine along with your flu shot in the pharmacy as well.
So you kill the proverbial two birds with one prescription.
Absolutely.
That's incredible. And should any of us have questions in the Twitterverse, you can reach us at #ICAAC, and we'll be happy to take your questions. Similarly, we have a live audience in here, and should they have any questions, we'll be welcome to take their questions. So tell us a little bit about how you got the students involved in doing this study at Campbell University. I'm sure they were really excited, and what did they actually do?
They were. These students were a group of students getting a master's degree in clinical research at Campbell University, and as part of that, they do a research project during their last year of the program. And this was a great, wonderful group of students. A couple of them work in the pharmaceutical industry, and they're doing this to advance their careers. And another one of them is a pharmacy student now at a school in Florida. And they were very interested in the issue of health disparities, which, as people know, relates to different levels of access to care. And they wondered with this vaccine if there were associations of vaccination with certain populations that might not have as much access to health care. For example, those below the poverty line, those with less education, or those maybe without a marital partner that nags them to go get their vaccine.
Well, you need somebody to nag because, you know, it's prevention. It's like doing the oil change in the car. If it wasn't for that sticker from Jiffy Lube, I don't know how many of us would ever change the oil in the car.
Right, and in fact, we did show a lower rate of vaccination among men compared to women.
Well, we're notoriously bad.
As you know, men aren't really good about seeking out their own health care, and they need someone to prod them to go in and get something taken care of.
I think, you know, the real issue at hand is to really understand this post-herpetic nerve pain. And I think, you know, when you talk to the general public, you know, we use fancy words, and I think we have to use the word pain. Mm-hmm. And I've often heard from my colleague who happened to be a woman who ended up developing shingles in her 40s. She said it was tremendously painful, and I don't think folks really appreciate how painful it is. And she said, I wish I had been vaccinated.
Absolutely. In fact, I was mentioning, I just saw a colleague the other night here at this meeting who is in his 30s and came down with shingles, shockingly, and he has 2 small children.
Do you think he could have gotten it from the kids?
He may have. You know, they've talked today about maybe the chickenpox vaccine loses their immunity over time, and that kids are coming down with chickenpox now when they're in 1st or 2nd grade.
And they're shedding virus.
And you can get it that way and reactivate. He also is a biker, and kind of maybe his immune system was down a little bit from this intense physical activity that he was doing.
Or
I know
maybe where he
marathon runners, bikers,
maybe
kind of
where
sometimes.
he was sitting on the
Absolutely.
seat, because
Possibly.
it lives in the, you know, the dermatomes, and depending on which one it happens to be living in.
And he was out of work for weeks, and just relating how difficult it was to take care of his children and work and everything with all of this pain that he was dealing with.
Yeah.
And the pain is the real thing that we're not really good today in medicine about treating nerve pain. Nerve pain is a very difficult type of pain to manage, and the medications for that are varied and not specifically developed for nerve pain. So that can be very difficult to manage.
Yeah, the thing that communicates to your brain that, hey, this hurts, it really is a black box in terms of trying to understand what's going on. You shared with me before we went on live the story about your mother. Would you care to relate that?
Oh, sure.
She's going to watch.
Wonderful story.
She's going to watch, so she'll be sufficiently embarrassed.
My mother was
Mom.
about to go on a cruise with friends of hers, and of course, everyone gets all of their health information from their friends, and her friend told her that she should call her physician and get a prescription for a Z-Pack to take on the cruise. Well, I went crazy. I said, why would you need a Z-Pack for a cruise? There's a physician on the cruise. If you get sick, he'll help you. You don't need a Z-Pack, and it doesn't even treat anything you would get on a cruise anyway. Most things people get on cruises are viral. I said, as a matter of fact, you're over 60. The thing you should be talking to your physician about is Zostavax, is getting a zoster vaccine. You are over 60 years of age. You don't want to get shingles, Mom. Well, in just the week after speaking to her, she hadn't had time to take care of that yet, and my mother actually came down with shingles in the next 2 weeks after that conversation. And I said, I told you so. I told you you were at risk for this. And it was just so ironic that the timing was such.
Now, you see, if it was my mother, she would blame me for having gotten the shingles because we talked about it.
It's all my fault.
It's all your
Absolutely.
fault.
I should never have breathed that word.
I mean, you know, these funny stories are really transformational, because I think that's effectively what the results of your poster are teaching us is we really have to be conversational with our patients. We really need to get the message out that the shingles vaccine is available, it's safe, it's relatively inexpensive, it's covered by most major medical plans once you're over the age of 60, and if the folks at ACIP get together and begin to review the data, looking at the efficacy and the long-term consequences and the value that vaccination has, do you think our friends at ACIP, the folks who make decisions about vaccines, will?
I think they'll come around. There was recently a paper in the last year from Ken Schmidt and the group looking at Zostavax in those 50 to 59, really demonstrating the efficacy of that vaccine, and I think that, and the safety of the vaccine in that population. One of the questions will come up about, do you ever need a booster dose of vaccine? Right now, it's a one-time deal. And I think that some of the questions about vaccinating those 50 to 59 are, could you maybe need another vaccine later, a booster? And we have yet to answer that question.
And I guess the only readout for that, rather than measuring titers, which is normally the gold standard, is to ask simply, do a retrospective study asking, of the people who were vaccinated in their 50s, how many of them developed frank shingles?
Exactly. And so that will take a little bit of time for us to gather that information. But I think with more individuals getting vaccinated in that age group, we'll have a great population to follow to document that.
I think that's what we really need to begin to look at, because, you know, the best medicine is prevention. And this vaccine is safe, it's available, and your mother's circumstances, she had issue about getting in to see her physician, but if I show up at my physician's office, will they be able to get me a vaccine? Is it readily available, or do they have to special order it?
The vaccine is readily available, but there are some particular storage conditions with it. It has to be refrigerated or frozen until the time it's delivered. So sometimes only certain pharmacies will carry it, but right now it's become more widely available. So your physician might have to send a prescription over to the pharmacy for you to get it and get it administered at the pharmacy, or they could administer it directly in the physician's office.
So if you're going to go to your local big box pharmacy, you with your prescription.
You can ask them about the availability of Zostavax. And I live in North Carolina, which is a very progressive state. They actually have signs in the pharmacy saying, we give Zostavax.
Wow.
So you can walk right into the corner pharmacy and get it there along with your flu shot or other shots.
Well, that's good news. Well, do you have anything else to share with us?
Well, I would just...
Oh, we have a question.
Excellent.
Please go to the microphone.
I'm Meg Terrell from Bloomberg News. I'm just wondering about the cost for people who aren't covered by their insurers in under 60, if they're trying to get it. How much does it cost for them?
People like me.
So the cost of Zostavax will vary depending on where you get it, but on average, the price is about $200 for the vaccine. Unfortunately, that's substantially more than you would pay for something like the flu vaccine, which most people can get for $15 to $25 cash at their local pharmacy or in their physician's office. But we feel that the cost of the vaccine is justified by preventing all the complications that could occur if you do develop shingles. The medications to treat shingles are even more expensive than that.
I think I'm just going to eliminate the special coffee in the morning to be able to afford it. And I think that's the message that I'll take to, I have the luxury of having a bully pulpit, being able to talk to medical students and dental students, and I encourage them to have dialogues with their patients of talking about anything.
Right.
And this is one of these high value topics, I think, at $200 to $400.
Right.
It's cheap at twice the price, because if you have to write the copay for one of the acyclovirs, famciclovirs,
Exactly.
and then the
pain medication.
The pain medication, which is chronic.
And the lack of sleep usually that occurs with all that pain.
Yeah, I think it's well worth it, and that would be my take-home message.
Right now, Zostavax is part of Medicare Part D. which means that it's covered under the medical portion, and patients who need Zostavax might have a deductible as part of their Medicare. And it's not covered under the Part B usually, and that can lead to people who only have Medicare insurance actually having lower rates of vaccination than those that have other insurance types. And that was borne out in the study that we did. We found that those with other insurance or other private insurance had a higher rate of vaccination than those with Medicare only.
But as you so eloquently brought up, this is a billion-dollar issue. And so it would seem that this would be worthy of a letter to our elected officials telling them if we want to cut healthcare costs,
Absolutely.
just make Zostavax available. And I have no dog in this fight. I don't own any stock in this, but you know, just my simple-minded healthcare economics. That's what I would think.
Absolutely. With the dialogue that we're having in America today about universal health care coverage and all that goes along with that, we're really in tune to how much dollars we're spending. And this is a potential area where we could do cost avoidance. We could save money by allowing people to get Zostavax as part of their routine vaccinations and their routine coverage and save the healthcare system money in the long run.
Well, we have another question from the Twitterverse.
Yeah, actually, this question comes from our chat room.
Okay.
And it comes from Marianne, and she wants to know how long before the vaccine needs to be renewed, and at what age is the magic age that you said we need to get it?
So right now, we don't know if there is a need for a booster vaccine. They've done studies to look at the durability of the vaccine, meaning how long you would be immune after receiving it. And it is a very durable vaccine response. That may depend on the certain individual's immune system, but overall, there's no need right now for an additional booster shot.
Which is why you get the vaccine when you're healthy.
Exactly.
When you're healthy as a horse, go to your doctor and say, could we please have Zostavax?
Right. And the vaccine is approved for anyone 50 years of age and older. There's really no magic age at this point, so it's a good idea if you're over 50 to go to your doctor and have that discussion about when you should receive the vaccine.
Well, thank you. You've been visiting with us today at ASM Live at ICAAC, and I've been Michael Schmidt, and we've been joined here by Dr. Melissa Johnson from Duke University and Campbell University, who shared with us the results from her exciting poster that's going to be down on the floor in a few minutes. So thank you, and thank you, Dr. Johnson.
Thank you.
Extending the legacy of a classic reference, ICAAC Plus joins the ASM family of periodicals this June. This growing collection of continually published reviews reveals our ever-expanding understanding of the biology of E. coli, Salmonella, and the other Enterobacteriaceae. From cell architecture and growth to pathogenesis of infections to life in communities, ICAAC Plus is the single source of knowledge about these organisms and their use as model microbes. A distinguished editorial board, led by Editor-in-Chief James Caper, ensures that content serves the needs of the research community. Free trials available for institutions. Take a look at ecosalplus.asmblog.org.